I still remember the day I found myself in a crowded emergency room, struggling to recall the exact names of my medications. At 80 years old, I was already feeling vulnerable, and the fear of not being able to communicate my essential health details to the medical team shook me to my core. In that moment, surrounded by the frantic hum of nurses and doctors, I realized I needed something more reliable than just my memory to keep me safe. I'd heard of medical binders before, but I never thought I'd be the one frantically wishing I had one. I made a silent promise. I would never let myself or my family be caught off guard like this again. It's a story countless seniors can relate to. Finding yourself in a situation where you need critical health information immediately, yet it's scattered in various file folders or in the far corners of your memory. For many of us, the challenge is that we've lived long, full lives with a paper trail of medical histories, insurance details, prescription changes, and more. We tend to think we'll just remember if anything urgent comes up, or we assume a family member or doctor will handle the details. But in a real emergency, every second matters, and confusion or uncertainty can cost you precious time. It's not just about the risk of miscommunication. It's about the very real possibility of losing your independence if a preventable mistake happens because of missing information. What I discovered was that by creating a medical emergency binder, organized, easy to understand, and always within reach, I was taking back control of my life and my choices. I didn't have to wait and hope that the paramedics would guess my medication correctly, or that my daughter would remember the date of my last surgery. This binder became my anchor of autonomy, a symbol of my continued ability to manage my affairs. And I promise you, by the end of this story, you'll know exactly how to create your own binder with 5 critical components that can safeguard your well-being and give you peace of mind. We're going to explore 5 specific elements that turn a simple notebook into a real lifesaver. From the obvious must-haves, like medication lists, to the surprisingly overlooked details that can make all the difference when minutes count. Make sure you stay until the very end, because the 5th component is something almost no one talks about, but could save you from a world of complications if you ever face a lengthy hospital stay or need specialized care. While I'm not a medical professional, everything I'm about to share with you is rooted in personal experience, years of observing friends and neighbors navigate serious health issues, and guidance from forward-thinking doctors who believe seniors shouldn't have to give up their independence just because they're getting older. In fact, many specialists are now encouraging patients of all ages, especially those over 65, to keep better track of their medical information, because preparation often spells the difference between a quick recovery and a long, stressful ordeal. Before we dive into the nitty-gritty details, I want to invite you to become part of this community. If you haven't already subscribed, please consider doing so and turning on the notification bell to stay updated on future videos aimed at helping you maintain your autonomy and live each day on your own terms. And if at any point you feel this information resonates with you, leave a comment or a 1 in the chat to let me know you're here. If not, feel free to type 0 so I can learn how to serve you better. Your input matters. This is our shared journey toward living a robust and fulfilling life, even when life throws its unexpected challenges our way. Now let's dive into the very first reason why creating a medical emergency binder can be a complete game changer. I want to start by telling you something that may sound a bit bold at first. You might be unintentionally making it harder for medical professionals to help you quickly. It's not your fault. Nobody really trains us on how to keep our health information in order. The common misconception is that my doctor's office has all my records, or my family knows my medications, so I'll be fine. In reality, doctors' offices, pharmacies, and hospitals each maintain their own files, and if an emergency happens, those files might not get shared fast enough. Your family, meanwhile, may have general knowledge of your health, but not the precise details paramedics need in an urgent situation. I learned this lesson from a dear friend named Eleanor, who is 78. Eleanor ended up in the ER with sudden chest pains. Her daughter was out of town, and the hospital had to rely on partial notes from an outdated medical record. In those stressful first hours, doctors made a guess at her prescriptions. Turns out, they missed one critical allergy warning. Eleanor spent the next 2 days battling complications from a medication her body couldn't handle. This story underlines a crucial truth. Relying on others to keep track of your details can be risky. If Eleanor had a comprehensive binder listing all her medications and allergies, she could have potentially avoided an unnecessary, frightening complication. This leads me to the first critical component of your medical emergency binder, a precise, up-to-date medication list. Most people think a simple scribble of drug names in the back of a notebook is enough, but here's the reality. You need to include the exact name of each medication, brand and generic if possible, the dosage, the frequency, and why you're taking it. Also add the prescribing doctor's name if you can. It should be typed or clearly printed, so there's no room for confusion. Keep a small note about any allergies or adverse reactions right on that page too. Think of this as your medical cheat sheet that ensures healthcare professionals immediately see the big picture. The practical step here is straightforward. Gather all your prescription bottles, over-the-counter meds, vitamins, and supplements, yes, even that daily multivitamin, and list them accurately. Update this list every few months or whenever there's a change. Print or copy it and tuck it into your binder. You might also keep a small copy in your wallet for quick reference. The emotional benefit of having this list is huge. The next time you see a new doctor or end up in an emergency situation, you can hand over this one page and feel a wave of relief because you're no longer reliant on memory or guesswork. By maintaining a comprehensive medication list, you're not just organizing data, you're quietly telling the world, I'm still in charge of my life. That sense of control might seem small, but it's part of a broader mindset that allows you to keep living on your own terms, no matter what challenges arise. This single step can transform a chaotic ER visit into a more manageable experience, drastically reducing the risk of medical errors. Now let's look at an equally important element that most seniors don't realize they need. A lot of people assume that if they have their insurance card in their wallet, that's all they'll need. But the common misconception here is that your card alone will unlock a smooth healthcare experience. In reality, the insurance process can be complicated with different coverage rules, co-pays, and policy numbers for different areas of care. Paramedics and ER staff often need specific insurance details before certain procedures can happen smoothly, especially if you're taken to a hospital outside your regular network. Take the example of Harold, age 82. Harold had a fall in his garage and ended up being rushed to a hospital he'd never visited before. While he did have his insurance card, he didn't have any of the additional policy details or secondary insurance information. It took hours of phone calls and administrative back and forth before the staff could confirm coverage for a crucial MRI scan. That delay could have been dangerous. Although Harold ended up fine, the whole ordeal was stressful and could have been avoided with better documentation. Here's where the second critical component of your medical emergency binder shines: a full insurance breakdown. Go beyond just your membership card. Include copies of the front and back of your insurance card, any supplemental policy details, the phone number for customer service, your policy number, and a brief note on coverage specifics, like emergency transport coverage, specialist copays, or in-network versus out-of-network policies. This single sheet of paper can act like a backstage pass that makes sure the hospital administration isn't stuck sifting through red tape when moments matter. The surprising insight: even the best healthcare professionals can only move as fast as the administrative hurdles allow. Having quick access to your insurance details saves you from unnecessary delays. The practical, actionable advice: call your insurance provider and request a summary of your coverage. Print it out and add it to your binder. Update it at least once a year or whenever you receive a new card or policy information. By doing this, you can relieve a significant amount of stress for both yourself and your loved ones. Knowing that you won't get bogged down in policy verification at a critical time is a powerful emotional benefit, giving you the freedom to focus on healing rather than paperwork. If you've found these first two insights valuable, let me know by typing a 2 in the comments so I know you're with me. And if you haven't yet, remember to subscribe and hit that notification bell. Your support helps keep this information flowing to those who need it most. Now let's move forward to a component that might surprise you. When I show people my binder, they often say, "Why on earth would you include personal identification documents in something meant for medical emergencies? The misconception is that your driver's license or state ID in your wallet is all you need. That's partially true for everyday identification. But in an emergency, especially if you're unconscious or incapacitated, additional ID forms can be invaluable to clarify any discrepancies quickly. Imagine paramedics trying to figure out if Elizabeth and Betty are the same person because your official ID says Elizabeth, but your medical documents refer to you as Betty. I saw this firsthand with a neighbor, Ruth, who was 77. She had a living will and power of attorney forms that named her differently from her hospital chart. The confusion led to a delay in contacting the right family member who had the legal authority to make decisions. This might sound like a small administrative hiccup, but during emergencies, every minute spent verifying a name or signature is a minute not spent on direct patient care. It's also a minute spent stressing about whether the right people are being contacted. The surprising truth, having consistent and clear identification documents in your binder, such as a copy of your driver's license, your social security card, if you feel comfortable, and any legal name change paperwork, can speed up and streamline critical decisions. The practical step is straightforward. Make photocopies of your ID documents and place them in a clearly labeled section of your binder. If you have power of attorney designations or a living will, make sure your name matches across all forms. If you go by a nickname, consider adding a brief note in the binder clarifying that Elizabeth and Betty are one and the same. Think of it this way. Your binder is not just a medical record, it's a passport that lets you move smoothly through life's unexpected challenges. Maintaining accurate personal documentation is part of safeguarding your autonomy. You don't want confusion over your identity to stall medical decisions or keep the right person from advocating on your behalf. The emotional benefit is knowing that no matter what happens, your wishes and identity will be respected, preventing the nightmare scenario of a hospital not knowing who to contact or which forms apply to you. This leads seamlessly into our next point, which addresses something even more critical: your voice, your wishes, and your legal protections. A lot of seniors assume that advance directives are nice to have, but not essential. The misconception is that family members or doctors will automatically know what you'd want if you can't speak for yourself. Unfortunately, that assumption can lead to wrenching conflicts and decisions that may go against your personal values. I've seen families torn apart by disagreements about whether to pursue aggressive treatment or comfort care. In the worst cases, medical teams do everything by the book just because they have no clear documentation of the patient's wishes. Take Margaret, age 79, who never talked to her children about how she wanted to handle end-of-life care. When a sudden stroke left her unable to communicate, her daughters argued bitterly. One wanted every possible intervention. The other believed in minimal, comfort-focused care. Margaret ended up on a ventilator for weeks, a choice she might not have wanted. Her children were left with guilt and regret, all because no one knew exactly what Margaret would have chosen for herself. The surprising insight here is that advance directives, living wills, and power of attorney documents don't just apply to end-of-life scenarios. They can also outline what you want in cases of temporary incapacity, like a severe but recoverable illness. Think of these documents as your personal microphone, allowing your voice to be heard even if you physically can't speak. The practical advice is to consult with an attorney or use a reputable form from your state's health department to draft these documents. Clearly outline your medical care preferences, like whether you want certain life-sustaining treatments if your prognosis is poor. Designate someone you trust as your healthcare proxy or power of attorney. Then put copies of these legal papers in your binder. Update them as needed, especially if your preferences or health status change. Emotionally, this step can be liberating. Knowing you have a formal plan in place means you retain control over your life's most personal decisions. It also spares your loved ones from agonizing over guesses and what-ifs. By proactively documenting your wishes, you preserve not just your autonomy, but also family harmony. The relief that comes with having these directives in a single, easily accessible binder is immeasurable. A quiet assurance that your deepest values will be respected. If you're finding these insights helpful, please let me know by commenting 4 down below. And if you haven't subscribed yet, please do. It's the best way to stay informed about steps you can take to maintain your independence. Now let's move on to the final piece, something almost no one thinks about but can be a game changer when an emergency spirals into a longer hospital stay or complex recovery. This last key component is often overlooked because it sounds so simple, a personal support map. This goes far beyond just listing your emergency contacts. The misconception is that as long as you have a spouse or a child to call, you're covered. But what if they're unavailable or overwhelmed? What if your recovery process is complicated and you need someone to pick up groceries, water the plants, or pay the bills while you're incapacitated? Many seniors end up losing their sense of autonomy simply because they don't have a clear plan for life's everyday details when they're out of commission. I saw this happen to Frank, who is 83. After he broke his hip, he expected to be back home in a week or two. His daughter was happy to help, but then she caught a severe flu, and suddenly nobody was handling his mail, paying his bills, or ensuring his home was secure. By the time Frank got back, some of his accounts were overdue, and his plants, ones he'd cared for since his wife passed, had wilted away. For Frank, those plants symbolized his connection to simpler times, and losing them added an emotional blow to an already challenging recovery. A personal support map can prevent that. It might include a list of friends, neighbors, or community resources like a volunteer organization or a nearby senior center that can step in to help with daily tasks. Add their phone numbers, addresses, and a brief note on what kind of support each can offer, whether it's driving you to a doctor's appointment or feeding your pets. If you have a house cleaner or regular gardener, jot that down too, so someone else can handle scheduling if you can't. Include a short list of routine tasks that need doing, paying the electric bill, taking out the trash, or picking up medications from the pharmacy. This may sound mundane, but the emotional payoff is huge. By having this personal support map, you reduce the risk of being forced into a facility simply because you don't have help for everyday tasks. You remain in control of your home and your life, even when you can't physically manage everything. Plus, the people around you will appreciate that you've spelled out exactly what you need, making it easier for them to offer the right kind of support that fosters stronger relationships and a sense of community around you. Once you assemble this personal support map, place it at the front or back of your binder with a clear label. Let your closest family member or friend know it's there. In an ideal scenario, you never have to use it, but if you do, you'll be grateful that you took this step to maintain your autonomy. By now, you've seen how all 5 of these components, accurate medication lists, full insurance breakdowns, clear ID documentation, advanced directives, and a robust personal support map, work together to protect your independence. These elements create a safety net that keeps your wishes, your finances, and your daily life in order, especially when you're most vulnerable. You might feel like this is a lot of work, but once it's done, the peace of mind you gain is truly life-changing. Let's take a moment to recap and see just how transformative these components can be. Consider how, without a binder, you may face delays in care or potential medical errors. You could experience needless stress while sifting through bills, or you might leave loved ones guessing about your final wishes. But with the binder, you step into each new day knowing that you have a robust plan in place. You're not relying on luck or memory. You're actively shaping your future, one organized document at a time. Close your eyes for a moment and imagine what it would feel like to walk into your next doctor's appointment armed with your binder. When the nurse asks for your medication list, you calmly flip to the page. If you're ever rushed to the hospital again, your family won't scramble frantically. They'll pick up the binder and have everything they need in seconds. Now picture the relief that brings, not just to you, but to everyone around you who cares about you. It's like handing them a roadmap with clear instructions instead of letting them wander around in the dark. I don't want you to wait until a crisis hits to put these steps into action. Emergencies rarely send a warning, and once you're caught off guard, you might not have the energy or clarity to gather all these documents. The best time to create your binder is right now, while you're thinking clearly and motivated to protect your independence. Even if it takes you a weekend of gathering paperwork and making photocopies, it's worth every moment. I'd love to hear from you. Which component resonated with you the most? Maybe it's the advanced directives because you've witnessed family disagreements before. Or maybe it's the personal support map because you've seen how quick a recovery can stall without everyday help. Whatever it is, share it in the comments. Your insights might inspire someone else to take action too. If you feel overwhelmed by all the documents, don't worry. Start small. Maybe begin with the medication list because it's the easiest step. Then tackle insurance details the next day. Before you know it, you'll have a binder that acts like a guardian angel in times of need. And if you found value in this, please like, subscribe, and share with your community. The more people who know about this, the more prepared we all become. Let's keep the conversation going. Whether you're 65, 80, or even 90, know that it's never too late to assert your independence. You hold more power in your hands than you realize. And this binder is just one example of how you can use it. Thank you for joining me on this journey, for trusting me with your time and attention, and for taking that brave step toward a safer, more self-directed life. With every document you place in that binder, you're quietly declaring, I am the author of my own story. And that, my friend, is a declaration no one can take away from you. Now let's get those pages filled and make sure we stay prepared for whatever life brings our way. I'll see you in the next video, and remember, you are stronger and more capable than you think.